I'm Dr. Ken Landau. Thanks for watching. Let's talk about heroin, or diamorphine as it's officially known, or diacetylmorphine as scientists tend to call it. It's an opioid. It's used as a recreational drug. It's used to give a feeling of euphoria. Comes from the opium poppy plant, Papaver somniferum. The natural products of the plant are morphine and codeine. The semi-synthetic derivative is heroin, and the synthetic derivative is methadone. In the United States, we tend to think of it as an illegal substance, but in other countries, it's used for legitimate medical purposes. In the United Kingdom, it's used to treat the pain of cesarean sections or heart attack or severe physical trauma or bone fractures, used for post-operative pain relief, even used for palliation in end-stage cancer pain. It seems that the heroin is more fat-soluble, so it gets into the brain a lot more quickly than the morphine, and as a result, it tends to be a preferred product. Well, the purity of heroin purchased on the street here in the country, well, it could be anywhere between about 10 and 40%, but it's becoming increasingly potent, and increasingly fewer substances are used to cut it, but it's still cut sometimes with aspirin and pseudoephedrine and antihistamines, and sometimes it's mixed with cocaine and methamphetamine and fentanyl or carfentanil, sugar, and unfortunately you don't know what you're getting when you make the purchase, so you don't know how potent it's going to be, and you don't know whether it's going to have the same potency from one time to the next. Well, it also goes by names of horse and smack and brown and junk and hell dust and cheese. The half-life of the drug is about 30 minutes. The duration of action of the drug is about 4 to 5 hours. It's from both the active metabolites. The active metabolites are 6-monoacetylmorphine. That seems to be a very major component of the morphine, a major metabolic product. Seems to interact with dopamine to give the feeling of euphoria. If you take the substance by mouth, as some people do, then it undergoes what we call first-pass metabolism. It goes right from the intestinal system into the liver. The liver changes it. Well, as a result, we call the heroin actually a prodrug. When it's metabolized in the body, it's a form of morphine. If you inject it, well, it avoids the first-pass metabolism. It rapidly crosses the blood-brain barrier, and because it's fat-soluble, more so than morphine, then it's going to act on the brain much more quickly and much more extensively than morphine. It's going to cause the euphoria and the lack of pain and the relaxation. And it seems that one of those metabolic products, the active metabolic product, the 6-monoacetylmorphine, well, that's going to react on a subtype of the morphine receptor that morphine itself doesn't react with. Different grades of heroin purity. We talk about white heroin, we talk about black tar heroin mostly from Mexico, used mostly west of the Mississippi. It's called black tar because it hasn't really been purified. If they continued the purification process, it would be white heroin. Most of the heroin used in the United States comes from South America. In the old days used to come from Southeast Asia and Southern Asia. It's estimated that somewhere between about 1 million and 1.5 million people are going to use heroin sometime during the course of the year. In the old days, minority males in urban areas accounted for about 80% of the people who used heroin. But now, at the present time, we find an increased number of women with private insurance and upper levels of income, more white women using it. So it seems that there's been a change. Now, with some of the drugs, you stop using them when you get to be about 20s, late 20s. Not so with heroin. People start and stop use of heroin over a period of many decades. Actually, we find that about 1/3 of the users are over age 40. If we look at the age of death from using heroin, it's in the late 30s, but we're finding an increasing number of people in their 50s and 60s who are dying from overdoses of heroin. The rate of death from heroin has increased by about fourfold in the past 20 years, often associated with some of the materials used to cut the product or with the other drugs that the person is using, maybe alcohol, maybe the benzodiazepines or other opioids or other substances. Well, now, as I mentioned, we're at a point where an increasing number of people using heroin are in the suburbs, in the rural areas. The incidence of use in men equals women. In the old days, it used to be the first opioid that was used was heroin. Then we started writing all these prescriptions for the opioids, for the painkillers. And people started using those opioids, and then they graduated to the use of heroin. And actually, if you started with the opioids, you had about a 40-fold increase in the likelihood of finally abusing heroin. Now, recently, since they've been putting kibosh on the number of prescriptions for the opioids, well, people are going back to using heroin as the first opioid. And actually, the use of heroin has increased by about 250% over a period of the past 20 years. Now, in the old days, people injected themselves as a solitary activity. But now, more recently, it's being used as a social activity in groups of people, and that's partly for safety, because if somebody overdoses, somebody else can then inject some of an antidote. It's estimated that probably somewhere around 90% of heroin users also use multiple other drugs, with somewhere about 60% using 3 or more other drugs. Now, if a person uses heroin, the single most common use is intravenously, injection. But some people smoke it or snort it or inhale it, inject it intramuscularly or subcutaneously, and now an increasing number of people are taking it as an oral tablet. Can use it either by itself or can use it mixed with other kind of drugs. So people very frequently use it in what's called crisscrossing, speedballs or fastballs, where they mix a line of cocaine and a line of heroin. Smoking or intravenously gives it the fastest route to the brain. That gives you the most sensation. But now people are using it anally or vaginally with suppositories, or snorting it or sniffing it. Orally, certainly less common than intravenous. There's little or no rush associated with it because it goes through that first metabolism, first pass metabolism, change into morphine. But actually, if you take the oral heroin for an equivalent dose, well, you're getting about 2 times as much of the morphine as you would if you took the morphine by itself. Well, intravenous use, also called slamming or banging or shooting up or mainlining, the prevalence really hasn't changed over the period of the past 30 years. It's about 50% of the people who use heroin. So not the majority of people. So the heroin base, that's used in Europe, but you have to heat it, you dissolve it in water, then usually you put some citric acid powder or some lemon juice in there and heat it and then inject it. Well, all sorts of potential for problems. In the East Coast, they use the hydrochloride salt, don't have to heat it. People inject it directly into the veins, but unfortunately, the veins in the arm collapse and they start using it in the veins of the leg. Then they could develop the deep vein thromboses, have a series of other problems with clots that move to different areas of the body. We know that the dose varies. Dose varies with frequency of use. So first-time users are probably going to use somewhere between about 5 and 20 milligrams. But over the course of use, a person could use up to several hundred milligrams a day once they become tolerant to the effect. But you don't become tolerant to the potential for sharing needles with the risk of HIV and AIDS and hepatitis. And then you have the common dispensers that are used in the water for preparation of the injections and the shared spoons and the filters. and all of that can speed up the bloodborne infections. But with an increasing fear of infections, people are now turning to other ways, like smoking. So they vaporize it and inhale the fumes. Well, they put it in glass pipes, or they put it in aluminum foil and heat it underneath, and then have rolled up foil and inhale it through there. It's called chasing the dragon. Or they can snort the powder. They snort the powder, they avoid the first pass metabolism, increase bioavailability of the product. That obviously gives an increased likelihood of significant reaction in the body, but people who begin injections, they don't want to snort anymore because they don't get the very rapid rise. Now we find people using what we call plugging. That's got little research to the present time. It's the suppository use for anal insertion, or the pessary use for vaginal insertion. They use an oral syringe to get it into the area. It's a recreational drug, obviously, that gives you euphoria. The recreational users prefer the heroin to morphine because they perceive different kind of effects. You get the intense rush. You have the warm feeling in the skin, you get the dry mouth, you get the heavy feeling in the extremities. And you have an acute transient state of euphoria when the heroin is metabolized to that 6-monoacetylmorphine. You have both the heroin and the 6-MAM in the brain at the same time. Some people believe that the euphoria with the heroin is considerably greater than with other opioids, and they think that it's due to that 6-monoacetylmorphine, and the monoacetylmorphine only comes from heroin. It doesn't come from any of the other substance and any other opioids. Well, the rush gives you a pleasurable sensation, enters the brain very quickly. If you inject it or you smoke it, it's within 7 or 8 seconds. Lasts about 45 seconds, several minutes. If you inject it subcutaneously, but skin popping or intramuscularly, it takes about 5 to 8 minutes to get there. If you sniff it, it takes about 10 minutes. But even before the rush disappears, you get watery eyes, and you get runny nose, warm, flushed skin. Person starts to perspire, lose the appetite, severe itching and slurred speech, and you start nodding off. Can develop pinpoint pupils and loss of sexual desire. So the initial effects are associated with the drowsiness that might last for several hours. You're in a trance-like state for maybe 4 to 6 hours. Mental function is cloudy. The heartbeat slows, breathing severely slows. In fact, the breathing can so severely slow that it might lead to life-threatening levels of lack of oxygen in the system that can cause permanent brain damage. So long-term use, change in your physical appearance. It can lead to collapsed veins, of course, and clots that can lead to stroke. Can change the liver function, lung function, kidney function, cause brain damage, skin abscesses, and because it's not pure substance, can lead to a type of arthritis, infectious arthritis, or insomnia, lead to risk of suicide and overdoses. And then we find that people who've been using the heroin for a long period of time can become depressed and anxious, have panic. They become aggressive and confused. Obviously, a lot of socioeconomic problems inside the home, divorce, family violence, domestic violence, child abuse. Women stop having periods, think they're infertile, but they're not necessarily so. Causes a lot of skin rubbing, and skin rubbing lead to excoriation and pustules on the face. Somewhere between 50 and 100% of women who are in addiction recovery, well, they claim past sexual abuse related to the heroin. Now, the chronic users don't have any pleasure anymore from use of the heroin. Instead, they continue using it to avoid some of the withdrawal symptoms. And because they crave sweets, They find that they lack the dental hygiene, so they have an increased number of decayed or missing or filled teeth, gingival disease, periodontal disease, fungus growing on the tongue, and meth mouth also is in those people who use heroin. Well, long-term use is going to change the physical structure of the brain, the physiology of the brain, some of the neurotransmitting substances of the brain, deterioration of the white matter of the brain, going to lead to change in the ability to regulate the behavior, and going to lead to respiratory depression and dry mouth and constipation and disorientation in people, confusion. Infections obviously are a major issue, not just of the skin, but also of the heart valves, of the bones. So in the spine they can develop an osteomyelitis, and actually the number of surgeries for osteomyelitis related to heroin increased 12-fold, 1,200%, between 2012 and 2016, because people were paralyzed or people were having leg pain. There's the slowness of the heart, but most importantly is the shallow breathing that occurs. And then people can develop some muscle spasticity, the sodium level can go down. People drive cars and then involved in motor vehicle accidents can develop a type of amnesia. But the fatal respiratory depression, that's a major issue. Now, after you've used the substance for some period of time, you develop a tolerance to that respiratory depression. But then if you stop using the heroin for a period of time, well, when you start using it again, you have to realize that you lose the tolerance just as rapidly as you gain the tolerance when you were using the substance. So if you start with the same amount that you were using at the time of discontinuation, you find that that might be sufficient to cause an overdose that might be fatal. And then we have all the substances that were added to the product, and then we have some central nervous system changes with the increased incidence of stroke, both hemorrhagic and ischemic stroke. And then, interestingly, not only do we have infections of the heart valve, we can have infections of the arteries in the brain. We call them mycotic aneurysms, and they can rupture. Or we can have aneurysms that develop in those people who are using heroin, and it's because of the heroin, not because of an infection. So they develop what we call saccular aneurysms. Saccular aneurysms tend to be in younger males who are non-white, oftentimes with hypertension, people who drink too much alcohol. Well, if you use the heroin on a relatively regular basis, one of the problems is that those receptors for the opioids in the brain, the mu receptors, the mu opioid receptors, they're going to be upregulated. And because they're upregulated, that means you're going to have to use more quantity to get the same kind of benefit. So that's going to lead to the tolerance. And then you also have the physical dependence. It's going to cause some problems when you try to discontinue the drug. Well, you can become addicted to heroin within 2 to 3 weeks of using it. Oftentimes you don't even realize that you're addicted. Some people start off, they use cocaine. Cocaine keeps them awake. They use heroin, help them go to sleep. But interestingly, not all users of heroin become addicted. Some use it only on occasion, like weekend use, and they don't increase the dose. There was an interesting experiment in the Vietnam War. About 20% of the soldiers were addicted to heroin. But when they came back to the United States, that rate fell down to about 1%. Reason? Well, people feared addiction. People were worried about the adverse health effects. They were worried about being arrested. And there was strong disapproval by their friends. Well, if you happen to be a pregnant woman and you're using heroin, then your child, when born, has an increased risk of having what's known as the neonatal abstinence syndrome, with seizures and fever and irritability and tremors and a slow increase in the weight and vomiting and diarrhea and excessive crying, and also an increased risk of death. Well, interestingly, in some of the European countries, they started looking at the heroin and in people who'd been trying to get off heroin, and some of the governments, especially in Switzerland, in the mid-1990s, they developed what's known as heroin-assisted treatment. So government facilities where you would go twice a day, you would receive your injections under medical supervision, you have to pay a small amount, but it was much superior to the methadone, and what they found was that the deaths decreased by about 60 to 65%, HIV infections decreased by about 85%. When the program started off, it was originally treating people who were less than age 30, 35. Now they're treating people who average over age 45. Well, as a result of the success, it started to be used in Germany and in Holland and in Denmark, even some of the cities in Canada. Well, we've known about heroin, we've known about the opium poppy ever since about 3400 BC. The Sumerians used it for medicinal purposes. Chemically, it wasn't analyzed until the 19th century. Actually, it was synthesized in 1874 by Charles Alter Wright. He was an English chemist at St. Mary's Medical School in London. Then nothing much happened. It was rediscovered by Bayer Pharmaceutical, by Felix Hoffmann in the late 1800s, 1890s. It was acetylated. They were actually looking for something else, but they found this, so they started marketing it. They marketed it as an over-the-counter product in 1895. It was used as a morphine substitute, not to get people off of morphine, but as a cough suppressant. They didn't think that the heroin was something that would cause addiction at the time. Well, unfortunately, also about the same time, a little bit earlier, 1853, Alexander Wood invented the hypodermic syringe. And as a result, if you look at the late 1800s compared to the 1990s here in the United States, well, in the 1890s, there was about a threefold increase in the use of heroin compared to what it is now here in the United States. Well, it was marketed, and then they found out that it was addictive, and then heroin was put under the law in the 1914 Harrison Narcotic Tax Act. They restricted use of the opioids. In 1924, Congress banned, actually, the sale and the import and the manufacture of all of these Schedule I drugs, that you can't use them for non-medical use. Then they said you can't use them for medical use. The League of Nations banned the substance in the 1920s. Most of the heroin was produced in Afghanistan. About 2/3 of the world's opium comes from there as of 1999. But then in 2000, the Taliban came in. They burned all the poppy cultures. So the production shrank by around 90%, at least as far as Afghanistan was concerned. But then in 2002, the American and British troops, they removed the Taliban. Cultivation went right back up. Then we find that Afghanistan again surpassed Burma, which was the second largest producer of the opium, the heroin. Other countries that make a lot of it, Thailand, Vietnam, Laos, but especially Mexico and Colombia here in the Americas. Now, most of the heroin in the United States doesn't come from Afghanistan. Most of it actually comes from Mexico and Colombia, the overwhelming majority, as opposed to, say, in Canada, where 90% of the heroin that's seized comes from Afghanistan. Well, there's a long history of the ups and downs as far as the prices are concerned, and how World War II was associated with a decrease in the use because they couldn't get it here to the United States. And then we had the mafia in Sicily that became a major producer of the heroin that was taken out of Afghanistan on the way to Europe and the United States. And then the different organizations started fighting with themselves. Changed the whole situation. Now, in the eastern United States, people talk about the number of bags of heroin. In the western United States, we talk about fractions of a gram. Typically inject about 2 to 6 times a day. The price varies with the amount of purity of the heroin, the geography, the neighborhood, the amount of adulterant. Talk about quarter bags, $25. That's enough adulterated heroin to snort or to inject several times a day. So the average person is going to use somewhere between about $20 and $200 a day. Well, heroin obviously causes a problem with physical addiction, and then when a person stops using the drug, has unpleasant withdrawal symptoms. Well, those withdrawal symptoms in some individuals who are heavy users can occur within a period of about 2 hours, but most typically it's within about 6 to 24 hours when the person begins to sweat, feels malaise, anxiety, and depression, and restlessness, general feeling of heaviness. They yawn or they sneeze, their nose starts to run. People have priapism and genital sensations that are unusual. They have insomnia and cold sweats. They have muscle and bone aches and abdominal cramps and watery eyes and fever, and sometimes even limb spasms. Limb spasms, that's where the term kicking the habit actually came from. Well, people can go cold turkey, and that's the acute event. It seems like the major manifestations are going to occur over the first 48 to 72 hours. But you can develop a chronic problem, chronic withdrawal, and that can last for weeks to months. That's the post-acute withdrawal syndrome, or PAWS. It's protracted withdrawal, and that's part of the reason that people who use heroin have such a difficult time discontinuing it, because these symptoms can last for 18 to 24 months. They vary between person and person. They come and they go. And these people develop the anxiety and the panic and the depression and the fatigue and the insomnia, the hypersensitivity and irritability and the memory loss and the mood swings and difficult time concentrating. So all of that associated in addition with early on, there's a decrease in the amount of dopamine. So it takes about 1 to 6 months for that to return to normal so that you can have the normal pleasurable sensations. And it also changes the level of the natural endorphins that you manufacture. Well, if you overdose, you can die within minutes to hours because typically lack of oxygen. But it's difficult to know because people use so many different drugs, mix it with different kinds of drugs, mix it with alcohol or the benzodiazepines, or it's mixed with the fentanyl or the carfentanil or the cocaine. Another problem is that once you overdose, you tend to vomit. So some number of people who overdose die because they aspirate the vomit. Some people have allergic reactions to the quinine that's used in some cases to cut the drug. And then some people die because they've been abstinent for a while and now they use the same amount that they used when they discontinued the drug. Overall, it seems that somewhere around 70,000 people die of drug overdoses every year. Now that's legal and illegal drugs. But if we look at opioid-related deaths, it's about 47,000. Fentanyl deaths, 17,000. Number 2 is heroin deaths, 15,500. Then cocaine deaths, about 14,000. The benzodiazepine deaths, about 11,000. Methamphetamine deaths, about 10,000. Reverse the effect with naloxone. But naloxone has a relatively short half-life, and it might be shorter than the narcotic that you injected. So you have to keep people under observation for a period of time because they might need a second injection or even a third injection of the naloxone. Well, 99% of the overdose deaths are less than age 25. So the majority of the deaths from using these substances in those people over age 25. Actually, if you look between 2012 and 2015, the heroin was the leading cause of drug-related overdose deaths in the United States. Since 2015, that's been supplanted by fentanyl. Well, we have some methods to help get you to kick the habit. We have behavioral modification that works a little bit. We have the opioid agonists, drugs like the buprenorphine or the methadone. We have the opioid antagonists like the naloxone. Now we're starting to get a little smarter. The public health agencies are starting to promote smoking or nasal use or oral use rather than the intravenous use. You want to avoid the overdose, so you get that mostly from the injections. Try to avoid that. And use a smaller quantity to start so that you really know what the strength is, because it might be cut with carfentanil that's 5,000 times more potent than the fentanyl. People are now discouraging the poly-drug use. Obviously, use clean needles if you're going to use the product. You have government exchange programs that are being developed. Also have to worry about some of the other opioid-related materials like the spoons and the water and the filters. Make sure that they're appropriately clean, sterile. And that's the story of heroin. It's a leading cause of overdoses. It's a semi-synthetic derivative of the opium poppy plant. It's metabolized in the body to morphine. Now, while it's a crime here in the United States to use it, you have to realize that it does have some medical uses. But at least as far as here in the country, maybe a more humane approach to the drug might be appropriate. And if the government finally understands that there are other ways of regulating it, not yes and no, but maybe help some of the people who are addicted to the material reduce some of the dependence on the possibility of infections, reduce the possibility of the crime that goes with it, make the whole process safer, reduce the sexual assaults, reduce the expense of hospitalizations, reduce the marginalization of a significant segment of society. All of that, obviously, very important. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.